So this is going to be for any of my patients that are dealing with wrist pain, maybe some numbness and tingling into the fingers, or limited range of motion through the wrist. We're going to go over some controlled articular rotations of the wrist, as well as some progressive and regressive angular isometric loading patterns. So first we're going to start with the controlled articular rotations. What we're trying to do here is basically grease the groove of the entire joint, so it's going to be slow and controlled. We're going to start, in this case, because we're dealing with wrist tendons that have started in the forearm, we're going to go into having our fingers fully extended. We're going to start in ulnar deviation or bringing your wrist in. We're going to then follow it as I'm exerting some pressure into full extension, following that range of motion into radial deviation, and then all the way up into wrist flexion. I'm going to repeat that 2 times in each direction. So next we're going to start with our PAILs and rails. That stands for progressive angular isometric loading, followed by regressive angular isometric loading. So what we're going to start with is just a forearm flexor stretch. So we're putting our wrist into extension. We're going to hold that for about 2 minutes. After about 2 minutes of that, that's when we're going to start the PAILs. So PAILs, what we're going to do is we're actually going to load our fingers down, pushing downwards, gradually increasing from about 10% of pressure to about 80% of pressure. And immediately after that, what we're going to do is we're going to fire up the extensors and be essentially lifting our fingers without not physically lifting our fingers off the ground. So if you just watch me here, we've done our stretch for about 2 minutes now. We're going to start by loading 10%, 20%, 30%, 40%, 50%, 60%, 70%, 80%. At that 80%, I'm going to hold for about 10 seconds before I do that regressive angular isometric loading. So I'm immediately firing up the opposing musculature for about 10 seconds, going all out at that 80 to 100% contraction. After 10 seconds of that, I'm going to relax. I'm just going to hold that stretch, and I'm going to repeat that series about 3 times.